Hello, today we are going to discuss a topic on mini mental scale examination. Hello, this is Dr. Rajesh. I'm a consultant neurosurgeon. My contact number is 888 Mini mental skill examination. Exactly what is mini mental skill examination? It is a 30-point based cognitive screening tool developed by Falstein in 1975. It is used to assess dementia, delirium, and cognitive decline. What is the purpose of MMSC? MMSC helps you quickly assess orientation, memory, attention, language, and visuospatial ability of a patient. It is important to note that MMSC is not a diagnostic method. Helps in only screening of cognitive decline. Structure of MMSC. MMSC structure consists of several points with each point consists of 1 mark, and the initial part of the examination of MMSC consists of orientation, that is orientation to time as well as orientation to place. For examination of orientation to time, the patient has to be asked with questions like what is the year now, what is the season now, what is the date today, and what is the date today, and what is the month this month. For examination of orientation of place, patient is asked with questions like which country he belongs to, which state he belongs to, which city he belongs to, and which hospital he is, and which floor he is, and each correct answer will be given with 1 mark. And the second point to be examined is registration. Patient is shown with 3 things and asked to remember the names of the 3 things and repeat the names of the things immediately after that. If he is able to recollect the 3 things immediately, then 3 points will be given to him. Examination of attention and calculation. It can be examined with 2 methods. One method, patient is asked to subtract 7 from 100 till 5 times, or 5 from 100 till 5 times. If he is able to do it correctly for 5 times, then he is given with 5 marks. And the second method is patient is asked to spell the word like world. After that, he is asked to repeat the spellings of the word in a reverse manner, like he is asked to spell like world, like if he says WORLD, then we should ask him to repeat the word in reverse manner like DLROW. If he is able to do the thing correctly, then 5 points will be given, or 5 marks will be given. Examination of recall. In the initial part of the examination, like during registration, we have shown 3 things. Patient has to repeat those 3 things correctly. If he is able to recall those 3 things and name it correctly, then 3 points will be given. Examination of language and visuospatial skills. Among it, the first point to be examined is naming. Patient is shown with 2 objects and ask him to name it. If he is able to name the things correctly, then 2 points will be given to him. And the second one to be examination, visuospatial and language examination, is reading. Patient is given with a slip containing a sensible sentence and ask him to perform the sentence in the slip. Like in this slide, patient is given with a slip containing a word like close your eyes and ask him to do the command. If he is able to perform the thing, then 1 point will be given to him. Third point to be examined in language and visuospatial skills is writing. Patient is asked to write a sensible sentence. If he is able to perform it correctly, then 1 point will be given to him. And the fourth point to be examined in language and visuospatial orientation is copying. Patient is shown with a pentagon, overlapping pentagon, and ask him to copy it exactly. If he is able to copy it exactly, then 1 point will be given to him. And the fifth point in examination of language and visuospatial skills is three-step command. Patient is given with three-step command and ask him to do it. Like example, patient is asked to take a paper on the table and ask him to fold it and keep it in the table or pocket. If he is able to perform all the three skills, then 3 points will be given to him. And the last point in examination of language and visuospatial skills is repetition. Patient is given with words like no, ifs, ands or buts and ask him to repeat it correctly. If he is able to repeat it correctly, then 1 point will be given to him. MMSE scoring and interpretation. Normal scoring will be like it is 25 to 30. When it is 21 to 24, then cognitive decline will be mild, considered to be mild. When the score is in between 10 to 20, the cognitive decline should be considered like moderate. If it is less than, it is considered to be severe decline in the cognition. What each domain represents in MMSE examination. If orientation is impaired, then that is localized to diffuse cortical problem. If the recall is severely impaired, then the problem will be lying on the temporal lobe. If attention is impaired, then the problem will be localized to frontal lobe. If the language is impaired, then the problem is localized to dominant hemisphere. If the coping is impaired, then the problem is localized to parietal lobe. Clinical correlation. In clinical correlation, in dementia, in the early part of the disease, recall will be impaired, but in down the line, in the late stage of disease, both language as well as orientation will be declined. In delirium, in the early part of the disease, there will be fluctuation of attention, whereas in the late part of the disease, there is poor orientation. In stroke, that too in the left hemisphere, initially repetition and naming may be affected. In the latter part of the disease, patient may become aphasic or impaired comprehension will be seen. Limitations of MMSE examination. Actually, MMSE is not so perfect. It has important limitations that must be considered when interpreting the results. Like MMSE interpretation or examination will depend upon the education level, language, mother language of the patient and age of the patient. And it is MMSE examination doesn't completely examine the executive function, as well as it is normal in case of early dementia. And the better alternative for MMSE is Montreal Cognitive Assessment. It is more sensitive for mild cognitive impairment as well as frontal lobe dysfunction. Practical clinical flow for MMSE. Actually, after doing an MMSE, scoring will be given to the patient. If it is less than 23, the cognitive decline will be considered to be present and it is considered to be abnormal. If it is less than 23, do lobar testing to the patient and do necessary testings like MRI brain and other lab investigations. Thank you.